This had better be a short video because it's not that complicated. So there was a person who is going to be involved in the government of my country probably, who tweeted that in fact maybe HPV vaccines increase the risk of cervical cancer or something like that. And then because of that, I didn't interface directly with that tweet, but I said just going to leave this here. It's a graph of HPV vaccination status and incidence of cervical cancer, cumulative incidence of cervical cancer. And you'll see here that the people who got the vaccine under 17 years of age, in particular, because if you get the HPV vaccine after you first exposed to HPV, which is usually sexually transmitted, the vaccine is not as effective. So it's good to get it to people early. And so people who got it before the age of 17 years old really had a very low incidence of cervical cancer. And I think in the study, it was like 8 total people in the study group. And then something like 800 of people got it total who were in the study group. And that's good. This is great news. So I wanted to talk about this tweet from this person in reply to my tweet that I just think is representative of a lot of the issue of the moment. And I don't want to be, I'm not mean about this. I think that this is a reasonable thing to ask. And I just think it's outlining something. It's not something that I think is anyone's fault necessarily, but it says, interesting that this study does not publish data on chance of cervical cancer, but diagnosis of invasive cervical cancer. By definition, this is a subset of cervical cancer diagnosis. So why then did they choose to only look at invasive cervical cancer and not all cervical cancers? And did that influence the data? And were they making that choice for a reason that might make the data look better or worse? Is, I think, a little bit implied here. And so if you are from a position where you might tend to be skeptical of something, or maybe you're just overall skeptical of everything, which is a normal way to go through life, you would say, oh, but this is interesting. They did not look at all cervical cancers. They looked at invasive cervical cancers. Isn't that interesting? And I said, can I make a video about this tweet? I promise I will be nice. And they haven't replied yet, but either way, honestly, it's on Twitter. I think it's okay to do. I think it's an honest question. And I think the answer to it is really interesting, both biologically and in terms of our information ecosystem. So let's talk about why they don't look at non-invasive cervical cancers.
A quick note. Hello. I had to tell you this because it's timely. Good.Store and dftba.com and all the stuff that we manage is about to stop guaranteeing Christmas delivery. After December 8th, we no longer guarantee Christmas delivery. It is either the 6th or 7th or 8th right now, or beyond that, in which case we have gift cards available. And also, you might get it. There's a good chance, but we're not guaranteeing it anymore. So if you want to get some super fantastic and very good stuff and all the profit's going to go to charity, check it out at Good.Store. Also, DFTBA is having its Sweet 16 because it's 16 years old and we have Sweet 16 type products. You can check that out. There's also a link to that in the description. All right, back to cervical cancer. All right, back to the information environment and cancer.
Cervical cancer happens 2 different ways. The majority of cases happen on the surface of the cervix, and they are caused by an HPV infection, which causes genital warts. And so basically it causes a little wart on the cervix, and that very rarely will turn into cancer. And if that weirdness on the surface of the cervix is a little bit too weird, they start to call that cancer. And in the case of what they call non-invasive cervical cancer, this is barely cancer and actually may resolve on its own. It's not deep enough in the body that anything weird has happened, so you can just burn it off with various treatments. You could do laser ablation or chemical ablation or stuff like that. Traditional escharotics from back in the early days of cancer treatment when we just burned stuff off of people. With that very early cervical cancer, you can just burn it off. You don't have to do surgery. You don't have to do chemo. You don't have to do anything. It's barely cancer. In fact, they call it stage 0 cancer. So it's not just that this is a pre-cancer, because in many cases, this is a pre-cancer. So this in situ stage 0 cancer would be considered cancer isn't always yes or no. This is that point at which it's maybe cancer. We call it cancer because it might very well turn into cancer, but it also might not. It might just get resolved by the body on its own. And it's not just because this cancer is easy to treat and not very dangerous. There's a very good reason why we don't include this non-invasive cervical cancer in these studies. And it is because the people in these studies are being observed much more than the general population. And we don't know because we don't do pap smears on people every 3 months. And also because if we discover non-invasive cervical cancer, we don't just leave it. we remove it. We don't like leave it to see what happens. So we don't actually know how frequently a non-invasive cervical cancer turns into a cancer and how frequently it resolves, because almost every time you have a non-invasive cervical cancer, you do some kind of like low impact treatment on the person to remove those cells. Then they go up for a checkup later to make sure that they don't have any cancer cells left. So because we don't know how often non-invasive cervical cancer resolves on its own, there might be a non-invasive cancer that happens inside of a year where you have a pap smear and then a year later you have another pap smear, and in that time a non-invasive cancer will have come and gone, and so it will never be detected by the normal screening that a woman gets. But these people who got their HPV vaccine are going to be screened much more than that because we're doing a study on them. And so you might see way more non-invasive cancers than you normally would because you're just getting screened more. And so these temporary cancers are popping up and going away really fast. And so they're not good to count because they're going to mess your data up. You might actually end up in a situation where if you count all those non-invasive cancers, the rate of cancer is going to look artificially very high in the unvaccinated group, whereas it's going to look very low in the vaccinated group because they're not getting these non-invasive cancers because they are vaccinated against HPV. So that would give you an artificially inflated view of the effectiveness of the HPV vaccine. So they intentionally don't look at the non-invasive cancers, because if they do, they're counting a bunch of cancers that would probably never be seen and never have any impact on the patient's life. But a couple of things about that. One, it's complicated. You have to put your head in the position of being like, okay, how often do people get pap smears? How often do they get non-invasive cancers? How often do non-invasive cancers resolve? Which way are we going to get better data? If we look at all cancers, including non-invasive cancers, or if we only look at the more dangerous ones that will definitely be detected at some point in a person's future, because if it's not detected early, they will die of it. This is a hard thing to correct for in cancer research. It's thought about all the time. It's created big problems in the past where we do better screening and then we catch cancers that might resolve on their own or that might not present as dangerous cancers for 20 or 30 years into a patient's future. So you have to be careful, and you have to make careful choices to make sure that you're finding a true result. And in fact, if this study had looked at all cancers, including non-invasive ones, that would absolutely have been used by people who want to push back against vaccine research. They would say, oh, you counted a bunch of cancers that actually it wouldn't ever have been real cancers or wouldn't have had an impact on the patient's life. And so you have to. And so the best thing to do actually is to only look at invasive cancers. But to understand that requires a bunch of work, and not the kind of work that you can necessarily do on your own. Why do I know this? It's because I've done a whole book's worth of research on cancer and cancer treatment. The only reason I know this. I wouldn't know how to look that up even. I learned that by reading a book at some point. I'm pulling from several different things here. I'm pulling from nonfiction book that I read where they talked about how screening is really hard and it's really hard to do science on screening. I'm pulling from research I did today on in situ non-invasive cervical cancer. I don't even know how I would do the research because I wouldn't know the terms. I guess you could go to ChatGPT and be explain to me why they wouldn't look into non-invasive cancer. And it would probably say, well, I know people don't like it when I use ChatGPT, but let's ask ChatGPT. And of course, you can't always trust ChatGPT either, but poses the greatest health risk, helps researchers identify why early detection sometimes fails, leading to more effective screening. Analyzing invasive cancers, studies can better assess treatment outcomes and improve public health guidelines to prevent severe cases, especially in high-risk populations. See, that's not even quite right. Why wouldn't they look at non-invasive? Yeah, this is wrong. It's just wrong. I can't imagine that if I searched Google for this, I'd find anything better. It represents the most serious stage of the disease. This isn't quite right. That's part of it. But you're not getting the full story, which is that, in fact, it would artificially inflate the number of cancers they saw. If they looked at all the cancers, it would make it look like the people in the study got way more cancer than a normal, typical person. ChatGPT didn't know that. Google didn't know that. I don't know. How would you even find that out? And this is a problem in a world where we must be skeptical of all things all the time, because we don't know everything. You know, I'm looking specifically at something I know quite a bit about because I've done a bunch of research to write a book about cancer. But like barely, I'm not an oncologist, I'm not a cancer researcher. I don't know how they designed the study methodology for that research. But what I have learned more than like how in situ cervical cancer works is how research works, and that people try very hard to control for a bunch of confounding factors. And so if there's a study published in the New England Journal of Medicine, I know that I don't really need to like do a bunch of work to make sure that their methodology is good, because people who know more than I do have done peer review on this paper. And I don't need to be doing peer review on this paper as a guy who does not know how things work. But we're in a world that where people are often asking us to be skeptical of absolutely everything and to do our own research. And I just don't know how you would do that research and come to the conclusion that there is a good reason why we don't look at non-invasive cervical cancers without like getting on the phone with a researcher. So like, I don't know. You have to be able to trust some institutions. And the like way that we communicate right now has degraded trust in institutions so much that it feels like you always need to ask questions that are very hard to answer, like on your own, without guidance from somebody who's heard about stuff. All right.
A final reminder, you can only get your products guaranteed by Christmas if you order them on or before December 8th. Thank you.